Hi, my name is Grisha Patel, and I'm going to be talking about hallucinogens versus cannabis. A hallucinogen is a drug that causes hallucination. That's where hallucinogen gets its name from. In the DSM-4, DSM, DSM is a diagnostic statistical manual of mental disorders, which describes about how to cure a mental disorder, not cure it, but different ways to help you with the mental disorder. Marijuana is a hallucinogen, which is used to usually relax. There's different effects depending on the dose and the user of a hallucinogen. Some of the signs are disordered sense of sight, hearing and touch, dilated pupils, anxiety or paranoia, mood swings, faintness, and irrational behavior. Hallucinogen changes the way your brain interprets time, reality, and the environment around you. They also affect the way you move, react to situations, think, hear, and see, which this affects the way you hear someone's sound or seeing an image. You can pretend you're looking at a lamp, but you're actually looking at a big chandelier, and you may walk into something. This happens a lot with hallucinogens where you're not in control of how much self-control you might maintain. Like, from time to time, this varies. Time goes very slow with hallucinogen. The use of hallucinogen may change the way you feel emotionally. They may cause you to feel confused, suspicious, disoriented. It also increases your heart rate and your blood pressure. And I haven't heard stories, but I know hallucinogens can put you into a coma depending on if you overdose. People do get addicted to a hallucinogen the way makes you feel. And the biggest thing about hallucinogen, it's illegal to buy, sell, or possess because these hallucinogens are very bad for your body, the way they react to your body, the way they make you feel. Your body can quickly form a tolerance for the hallucinogen, so a person might take more and more of a hallucinogen, a drug basically, because they like the way it makes them feel. It's very dangerous because taking stronger doses of any drug may cause severe side effects, and which is including overdose, and people may not think that they're overdosing, but they're getting addicted with this overdose and it's affecting them inside a lot. The body hallucinogens also has a long-term effect that may include decreased motivation in doing activities, going out, just being getting up and being able to do things. It usually prolongs depression. So it starts depression. You can basically feel like you're alone. That's why you take a hallucinogen, to make you feel like, you're relaxed, you don't have any worries. Some people, they never know what reality is because hallucinogen makes you feel a different way. It makes you forget about reality. It also causes anxiety and panic. You can never predict a bad trip because the consistency of a hallucinogenic drug, it may differ from the strength and purity of the drug. So depending on where you get it from, the quality you get it from, there are things where people say there's a good and bad marijuana. There's different types of hallucinogens, not only marijuana. They come in different forms. Hallucinogen can be taken as pills, can be smoked, it can be even eaten in a type of way if you talk about it. It's very common for someone to take it because they're having problems in their life. A hallucinogen can cause flashbacks. Effects of the drug, including hallucinations, can occur weeks, months, and years after use. Back in the day, in 2006, a study was shown 96% of the 12 to 17-year-olds have never even tried a hallucinogen. Nowadays, it's much more common. 2017, there's teenage boys doing it, teenage girls doing it. There's no control over it. High schoolers, this is what they usually get in trouble for. College students take it. A lot of people usually take it to study for exams. A lot of people take it to relieve stress, just release how they feel inside. They may be too tensed. It says that majority of the teens are not using hallucinogens. That was back in 2006. Again, this is 2017, where about 1/4 of the population is not using it. 3/4 of the population is. It helps. So as people say, it helps in the way they think, but that's because that's what they're relying on. They're not looking for help outside. The types of hallucinogens are LSD, mushrooms, ecstasy. These are just different types of them. Marijuana is the much more common. Mushrooms also come in pills, I think. Ecstasy comes in pills. So these are just a very few that hallucinogens that there is. So the difference between a hallucinogen and a cannabis is a hallucinogen is already a drug that can be taken, while as a cannabis is a plant which produces hemp fiber, and it can be turned into two different illegal drugs, marijuana and hashish. Marijuana is the most common one. It's illegal, but sometimes it is used for medical reasons. It shows that it helps with chemotherapy, people with seizures, chronic diseases, and many other things. Um, marijuana is not FDA approved because it's researchers haven't conducted enough large-scale clinical trials that show the benefits of a marijuana plant outweighing its risk in patients it's meant to treat. No one has died from marijuana yet, but it hasn't shown any benefits from using it as a medical treatment, so it's not legal in a lot of states besides California. I know there is other states, very few, that use marijuana as medical reasons, but I don't know more about it. But cannabis is actually a tall plant like this one. The yellow things right here are what is produced as hemp fibers, what can be turned into marijuana, and that is usually smoked or burned, where as in they use a bowl. Before, back in the days, used to use as a tobacco bowl, and they used to burn, old people used to burn the tobacco and smoke it. Now they use marijuana. The effects of marijuana use are bloodshot eyes, memory slips about things that just happened, behaving silly or giddily, attention span is diminished, coordination is impaired, and appetite is stimulated. There is no difference between medical and street marijuana. They're the same things, just medical marijuana is found in dispensaries, and also as one of the long-term use of marijuana is there's a couple of long-term use of marijuana: lower IQ for adults, decrease in reaction time, altered perception, reduced alertness, concentration. You can't really tell you can't really explain the way you feel. You can't really explain what you're doing. You can't explain what you. A lot of people can't drive throughout this because your eye-hand coordination is just deceived in a way where you're taking a drug that increases your heart rate, and it causes your respiratory problems, where it causes a cough, a chronic cough that's very bad because you're inhaling the smoke that's causing your lungs not able to get oxygen, affecting your lungs. It increases risk problems for people, also increases problems for an unborn baby. Some of the many dangers in marijuana usage is the producing odd visual of experiences, changes of body image. Marijuana has the same chemicals as tobacco, which is known to cause cancer. It can cause lung cancer. It's not tobacco, but it can cause lung cancer. And no one has died from marijuana, as I said, but it changes the way blood is flown to your brain, so around the memory and attention parts. So it can cause the way you you act, the way you feel, the way you understand something. Some people said that marijuana is great for them because it helps them study. No, it affects the way you concentrate, the way you take in information. It's also the decrease of ability of immune cells in lungs to fight off fungi, bacterial tumor cells. Marijuana can be abused, as in where people take in too much, and they never know what reality is because they're just so used to the feeling of high that they never want to get off. So as soon as it's starting to wear off, they start taking more, and it takes them a lot more, and their body starts to build a tolerance on it. And with over time with that tolerance, their body really doesn't know what reality is, and they never get out of that situation of feeling. And that's one of the biggest dangers in marijuana usage. That's Marijuana helps people with disorders. It's not supposed to be used as a recreational activity where people just do it for the hell of it because, it makes them feel good or it relaxes them. Those are not excuses to be used for to use marijuana or any hallucinogens in general.